Good afternoon, Mayor Marv Calvin for the City of Willmar, and we're here for a press conference to talk about the COVID-19. Our community emergency preparedness folks are here, along with folks from CentraCare Health, and the infection control physician from CentraCare Health as well will be making a presentation, along with Harlan Madsen, the chair for the Candidacy County Board. As mayor of the City of Willmar, I want to make sure that the public is aware that this COVID-19 is a very, very serious pandemic. It is affecting our country, our state, our county, and our city. I am asking each of you as citizens of Willmar to be prepared, to have food at home, and also to practice social distancing, along with limiting unneeded trips to grocery stores and other commerce. The governor has already shut down our bars and restaurants, and our grocery stores and some of our mercantile are limiting their hours as we speak. This is for your own safety and the safety of our community and the safety of our state and country. It is very concerning to me as mayor, as I drive through the community attending various meetings and press conferences like this, that I'm still seeing a lot of social interaction happening. You will see in our press conference today that we are keeping the 6-foot social distancing as much as is practically possible here. We do understand that there are family units greater than 10, but we are asking you to keep your limit to your social interactions to 10 people or less, and to maintain social distancing as much as possible. I want to give a huge shout out to some of our local businesses who are allowing the elderly and those with medical concerns to shop prior to the normal business hours being opened. I would respectfully request that you listen to these hours and follow these hours. I know a number of our grocery stores are doing this, and I would ask you to respect those individuals who are trying to maintain their health as best they can. As the City of Willmar, we have closed all of our city buildings to the public out of a concern not only for you, but also for our employees. We are asking people who have traveled within the last 14 days to self-quarantine for 14 days at home and isolated. This is very, very important that we control this, not only to flatten the curve, but also to control this virus. As you will hear shortly, this is a very concerning virus. The emergency response folks for Candidacy County are ready and prepared at this time to respond to your medical emergencies, although you will see an abbreviated response to what you may have seen in the past. With those comments, I will turn it over to Harlan Madsen, the County Board Chair for Candidacy County. Mr. Madsen.
Thank you, Mayor Calvin. I want to emphasize and support what Mr. Calvin said as far as the social distancing and respect and courtesy for other individuals. There are 3 main items from a county that we are focusing on. Number 1 is public safety, the employees' safety, and for the containment as much as we can. We had a significant meeting yesterday with a number of discussions and some decisions. We have a special meeting tomorrow morning at 9 o'clock, at which time more decisions will be made. There are significant 3 items, and I want to repeat 3 items that are crucial. 1 is focusing on safety. 1 is focusing on containment. The other, which has not been talked about yet, is mental health. The stress and anxiety that we are feeling, that our kids are feeling, that our employees are feeling, that our parents are feeling, that our grandparents and so on, needs to be dealt with, needs to be acknowledged. We need to care. We need to care about each other at that point because the stress is phenomenal. Local schools have canceled, certainly. Now we're looking at proms and other things. Those have a tail effect on all of our employees and all of our community, all affecting the economy. With all due respect, make sure you isolate, make sure you sing your ABC song when you wash your hands. Do the things that we learned in preschool. but be diligent and be serious about this. Thank you. Dr. Mensis.
Thank you, Alan. So, my name is Lucia Mensis. I'm the infectious disease doctor for Caris, and I'm a consultant for the county as well. I want to emphasize that this is very serious, and it's the kind of situation that doing infectious disease you would never like to have to see in your life. I'll briefly discuss about the virus, just to clarify. We've been saying a few times what this virus is about and the seriousness, etc. But I want to address the reasons of why we ask you to take these measures, because I do understand that for most people, you look around and you see nothing, and this is similar to the scenario of saying, just think about this parallelism. It's a scenario like if we told you there's a tornado coming, you do not see the tornado, but we know it's coming. So do consider that in parallel to what I'll tell you, okay? So this is a virus. We had 4 all the time in the community. They are not particularly dangerous. In 2002 and 2003, we had SARS, that you might remember, that came and went. Luckily, it was deadlier than this one. And we still have MERS in the Middle East that is much deadlier than this virus, but is somewhat controlled. Now, this is the 7th virus. It's very important to acknowledge that the mortality, the chance of dying, and with that more people also get sicker, is at least 10 times more than a bad flu. So that's very important, because if this gets to flu-like numbers, 10 to 50 more times people will die, and in parallel, roughly 10 to 50 more people will get very sick. And that would be something that potentially would collapse the healthcare system and the society. Now, the way to prevent this, like a tornado, is to get out of its way. I understand that you wonder why everything is okay. Can I get together with my family? Nothing is happening. I'm young and healthy. But it is coming. I don't need to get into details. You just turn on the TV or the media. I previously quoted cases of Europe. That's out the window already, because you only need to look to New York and Washington State and California, and things are pretty rough in there already. So we need to be prepared. As I mentioned earlier in previous conferences, we have no plan C here. Plan A is we act early, get out of its way, and pick up whatever damage it does. Plan B is we do the same late, causing a lot of damage. There is no plan C. This is relentless. It's a virus. If you stand next to it, it will infect you. If you are otherwise healthy, you might ride it out, but you'll pass it on to other people that could get very sick and die. So just to emphasize that very, very clearly, we're not seeing anybody sick around us doesn't mean anything for this. Only means that it's not plowing through us already, but it will. If we get out of its way, it's going to do it at a much lower rate. So that's the rationale why we ask you to please do not get together in large groups. I would suggest just stay home and go, do whatever you want. You can run, you can go to your yard. Don't get around people, because we have to have the system in place for when this hits. This is the rationale for it. And again, as I previously mentioned, this has nothing to do with our rights and freedoms, etc. This does not care about that. This is nature against us. So it's coming, we had to get out of its way. Anybody from the press has any questions on this?
Could you talk a little bit about the testing availability in Ojai County?
So the testing, unfortunately, it has been communicated nationwide that testing kits are short. And that's quite problematic, because, as you know, there's no vaccine available. That could take time, and we don't know the quality of the vaccine. We have no therapy that would work for it. So the only way to have a finger on the pulse on this was the testing, and we don't have testing capabilities that are robust at this point. So County Ojai is in the same place that the state is and the whole country is right now, that we are short on testing. So we are trying to navigate around that. So the last line of defense for that is for people to isolate. And I know it gets into people's daily living of what they are free to do or not to do, but we have no choice. We are not imposing this. We are begging you to do this because we as human beings are all on the same boat. So if we don't do it now, we do it late with consequences. And if in 3 months or whatever time you told me you were overreacting, I would say, thank you for telling me that. That means we did our job. Any other questions?
Make sure and repeat the questions if they ask.
Huh?
Make sure to
Oh,
repeat
sure.
the questions.
The question was about testing capability. Sorry, I didn't repeat the question. Yes.
Are you seeing many requesting the test?
We had up to very recently people, oh, sorry. Yes, the question is, are we having many people requesting? Yes, we've been getting many calls for people to be tested until we had this news last evening, really, that we were short on testing kits from the state and nationwide. We were getting many calls and testing many people. And, as for the whole country, this is very stressful because this was our way to know what was going on. So having lost that, we need to really, really, really contain this. So all we ask is for people to stay out of harm's way. Any other questions?
Dr. Smith, do you want to add to that?
Yes. Yes.
I want to thank Dr. Mincy for those comments. He's done an excellent job for not only Caris, but also for the entire region. I'd like, first of all, to thank everyone who's here today and the people in our area. I've lived in Minnesota for about 35 years now, and the one thing I've discovered about this state and this region and this city and county is that everybody cares about each other. So we've been pretty impressed with the way people have responded to our concerns about this virus. Dr. Mincy obviously is very concerned about the spread, and we're trying to mitigate that with the social isolation. The clinic has made a number of steps in order to help protect our community and the people in our community, and the hospital as well, and we'll expound on both of those a little bit. We have separated our urgent care and the remainder of our clinic so that people who don't have upper respiratory infections can come in through a separate entrance from the ones who have respiratory infections, so we can keep ill patients away from healthy patients. If people in the community don't have an illness or don't have an urgent concern, we're asking you to maybe not come in for a while in order to continue the self-isolation. At the same time, if you're concerned about something, if you have an illness and you think you need to be seen, we still want to be there for you because we know life goes on and people do get ill, and we want to be able to still take care of our patients. So if you have questions, be sure and call, and we're here for you both at the hospital and at the clinic. You are probably already aware that we have discontinued elective surgical procedures in the community. We don't want to expose patients to unnecessary exposure to the virus. We will still continue to do necessary procedures, and so you will be hearing from the surgical center or the clinic staff if there's anything scheduled so that we can address those procedures going forward. So it's all in an effort to keep people safe, to help make sure that we can stop the curve on this virus, because as Dr. Mincy said, we'd love to look down the road in 3 months and see that not people were seriously ill and we didn't have deaths from this virus, and then we'll be real happy if people accuse us of overreacting. That would be a good thing. Would you like to comment on hospital preparedness?
Sure. Good afternoon. I'm Ken Flo. I'm an emergency physician, and I'm the co-incident commander for the COVID-19 response with Caris Health. The co-incident commander position is a position that's designed to help coordinate all kinds of myriad activities and professionals and expertise for a response to an emergency situation. It could be an emergency situation like a train derailing, or it could be an emergency situation like what we have now. This is, for real, an emergency situation. We have activated our incident command process. We have all the right people at the table that are doing all the right things. For example, earlier it was mentioned that we had drive-by testing. We had created that entire process such that we would be able to find out the number of patients, number of citizens, number of neighbors that were infected. And we did that for a while we had testing kits, and now we can't do it because we don't have testing kits. But that's an example of something that we created from scratch in response to this particular emergency. The elective cases that's a hardship for everyone. People don't just sort of want to have surgery, they need to have surgery. Some cases, however, are more safely put off for time when there's less risk of exposure to a virus. So that's why we're doing that. It's clearly a safety issue. The social distancing part is very pervasive. Even our administrative meetings related to this are compliant with the social distancing. We had a meeting this morning and everybody was careful to be more than 6 feet apart, for example. Containment, like Dr. MinC's mentioned, is absolutely critical. That's what the social distancing is for. The rest of the process is when people do get sick, they can get very, very sick. People can die from this. It does have a much more common end result in terrible respiratory failure. And we have worked with our partners in St. Cloud to be able to care for more critical patients here in Wilmer. And our partners in St. Cloud are also creating a special space for those most critical respiratory failure patients there. So it's a beautiful example of the value to the community of creating CARES within CentraCare.
Can I help? Thank you, Ken. I wanted to add a couple of more things that go to the concept of, again, why people might see that nothing is happening around. Number one is what is called the exponential increase on this. That means since late January, we have 7,000 cases. Ignore the absolute number. That's 7,000 times more. For each virus, 2 or 4 more can happen, and there's nothing to stop the virus. So if you look, Friday in the country, we were around 1,600. We doubled to 3,000. Now we are in 7,000. Just do the math, doubling the number every 2 days, and the virus will not stop. That's the only thing it does. So nothing external will stop it. One question that comes to that is seasonality, when it gets warm. Then I refer you to southern Florida, where nobody can argue is pretty balmy right now. They doubled the cases in 1 day. So they are roughly in 300 cases or so. Where you think they'll be tomorrow if they don't stop. So you don't need to look at the southern hemisphere where it's summer and they have cases doubling and shutting down countries already where it's summer. Or you don't have to look at Italy to see a case when things got out of control and emergently they had to shut down the country to a halt. You just had to look at New York and see what's going on now. They're close to deploying the army there. And if you look at seasonality, look to the southern states, even getting faster growth than in here. So it's our duty to stop this. We are the target and we are the solution. Any questions from the press? Yes.
Earlier today, we talked to the Renville County victim who is now recovered, and he talked about how he took a trip to California and felt fine but felt ill a couple days after he got back and then got tested. So if someone has just gotten back from a cruise or some vacation abroad, maybe to a place that's a hot spot in the last couple weeks, should they go in and be screened or tested, or what should they do?
Yes, thank you. That's a great question. Yes, sorry, forgetting to repeat the question. So the question is for people who traveled and just returned, how should they approach this? We think the incubation for this, incubation meaning this progressing to symptoms if you were exposed, is no longer than 2 weeks. So we are asking people 2 weeks home quarantine and being isolated from people in the home. Every time I say this, remember, we have no choice here. This is another human being or somebody who disagrees with us. This is a virus that is going all over the world on this. So we have 14 days, and it's going to be very, very disruptive for healthcare providers in particular, because we'll have people who might get ill and will need to stay away. For companies, we are going to have to do that, and it's very complex, and the ramifications are going to be very, 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 they're going to be enormous. We all know that, but we have no option. So we are asking people who travel 14 days, stay home. If you need to be seen, you call. But we don't ask people right now to come if they have mild symptoms and they can be fine at home, because we lost the opportunity to test people. This could change, and if we hear that we could test people again, which is our way to know where we are at, we will test. But remember, it's very critical right now to do these self-isolations and stay away from each other, because these numbers that I was giving you, we are potentially close to losing them if we have no testing kits. So we'll be all based on symptoms. And many people have no symptoms and can transmit. Many people have a sniff and they can transmit. And many people get very ill and many people do die. Any other questions?
You feel, in conjunction with St. Cloud, that you have the resources for the first wave of people, and together, will you have enough resources for a prolonged period of time where you've been caring for people?
I will probably pass that question to.
So, and I don't know if I introduced myself before, but I should say that I'm Cindy Firkin-Smith. I'm co-CEO of CentraCare Health. We are working to make sure that we have the resources. We're working very closely with CentraCare, and we have a plan on how we'll share patients, critically ill patients, at each institution. One of the things you need to realize with this virus is, as the number of people who become ill with this virus increases and our resources are dedicated toward taking care of them, we still need to take care of the patients that have heart attacks and strokes and are involved in trauma. And so we want to make sure that we also have the capabilities for caring for them as well. So we've worked out for stratification on where we'll take care of patients and how, depending on the critical nature of their illness. One thing that's of great concern right now, and this is across the country, is that we have a shortage of supplies. We already know that we have a shortage of testing kits. We're also looking at shortages of masks, gloves, personal protective equipment, even hair nets. All kinds of things are in short supply. And that's one of the reasons why, in addition to safety for our patients and staff, that we've cut down on elective procedures, is to hold on to that equipment for when we really need it for critically ill patients and patients who come in with trauma or heart attacks. So we are planning for all of that. But there's no question that those things are in short supply. So as they become available, we plead with people to not go out and buy those things and hoard them, because medical facilities, healthcare institutions really need those to take care of patients that are ill. Are there any additional questions?
I have one question for Marv, Mayor Calvin.
For the medical.
Oh, for the medical? No.
No? Okay. Thank you.
Again, Harlan Madsen, Chair of the County Board Commissioner. I want to emphasize that for those of you that need county services, please call in or go online. We're emphasizing as much as possible to maintain the service without the direct contact, which is difficult because many of our requirements require face-to-face. In this time, we have to go the extra mile, so to speak, or extra 6 feet, so that we have that distance with all due respect. So if you have any questions, as any individual that is working with county services or have a question to county services, call in, please, either to your caseworker, to the main office, administration, and they and we will work together to make sure that we have that communication. Thank you.
We've been very lucky today to have some experts in the field, and we are very pleased that those individuals are here. I have a question for our emergency response folks, and I just want to make sure, Brad, can you talk a little bit about dialing 911 and when you should be calling 911 and when you should be using the other non-emergency numbers? And we'll get with Rudy and we'll get them posted up so that when we do the rebroadcast on this, we'll have those numbers available.
Good afternoon. Thanks for your attendance today. I am Brad Hansen, the Director of Emergency Medical Services for CentraCare Health. Really, the intent of 911 is for emergent use only. We understand that when situations like this occur, people's normal thought processes may not always work for a workflow that would keep them from understanding the importance of that. So we just ask that if you do have signs and symptoms of COVID, certainly contacting our local clinic and health system is most important, and ask their physicians what they want you to do. If it's truly a medical emergency, dialing 911 is important, and our dispatchers will be asking questions of the caller to indicate what the signs and symptoms might be and to let us know for sure what we might be dealing with. I just want to assure everybody that our emergency medical services system in Candioi County and across central Minnesota is very strong, and we've been working very hard to prepare for this event and any other large events in the area. Thank you. Any questions?
Ask, in terms of daycare for your staff and that, are you hearing that that's working out all right?
Yeah, so thankfully, Governor, repeat the question. The question was whether or not we have healthcare providers, daycares for our kids. Thankful to Governor Walz for his ability to think through that process and understand the importance of what the ripple effect of something like this is for our healthcare workers. This information has been shared with all of our staff across CentraCare and CareS Health, and we're making sure that they understand that they have that option available. I do not know how many have actually decided to use that option. And also thanks to Dr. Holm, the Superintendent of Schools, for allowing that to happen locally as well. Any other questions? Thank you. I'll turn it over to Chief Hansen from Wilmer Fire.
Good afternoon. I'm Frank Hansen, Fire Chief for Wilmer Fire Department. And just to expand on that question a little bit, we have put it out to all of the emergency services as well for the child care at the school system. And I believe they have a very good plan in place. So we're moving forward with that as well. Is there any other questions for me? As regarding response, emergency response from the Fire Department, Public Safety of the City of Wilmer, kind of business as usual right now. We will take each situation as it comes and adjust as we need to adjust. So I'll turn it over to the Mayor.
Again, thank you for tuning into this press conference today. You've gotten a lot of good information, and the takeaways we have is that we want you to stay home if you do not need to travel. We want you to stay home and allow people that are in the high-risk areas to be able to shop first. We also want to thank our local businesses for the impact that we know you are having on your businesses. We will support you, we appreciate you, and we want to make sure that we are all able to continue our services. And again, all of our city buildings have been locked down, and if you have business that needs to be taken care of, we ask you to do that by phone or over email. Thank you for the partners that have showed up. Thank you for the press for being here to get the word out. And as a community, let's stick together, reach out to that neighbor who may be elderly and feeling a little bit overcome by all of this, or people that need additional assistance. Please reach out to your neighbors and support them. I also at this time want to thank CareS Health and our emergency responders for being here as well, along with our folks from Candioi County. Any questions for me?
Mayor, just I know the city has an existing curfew ordinance that applies to juveniles. Do you anticipate that there might be a time where it might need to be expanded if there's problems with people congregating and things like that?
The question is on the curfew, and the curfew currently applies to our juveniles. At this time, the city of Wilmer is not extending that curfew or changing that curfew. We're leaving it the way it is. Our emergency response staff will be evaluating that along with city staff. City staff is meeting on a regular basis at a department head level to evaluate the resources that we have and evaluate the responses that we have. Additional questions for myself? Thank you, and this concludes the press conference.